I'm going to be talking about body-focused repetitive behaviours, or BFRBs. What are BFRBs? BFRBs are a group of behaviours including compulsive hair pulling or trichotillomania, compulsive skin picking or dermatillomania, or nail biting. These behaviours are often damaging to the person doing them, unwanted, they don't want to be causing the damage, and they often feel a high degree of urge to complete these behaviours. Sounds a little bit like obsessive compulsive disorder, and at one time these behaviours were considered a subtype of OCD. Now we would consider them an obsessive compulsive related disorder. That is, it's like having a cousin of OCD. There are many tips you can read about for how to manage body-focused repetitive behaviours, but it is important to know that it's a very complex set of behaviours that can be difficult to stop, and that's why it can be so frustrating and there can be so much shame associated with these behaviours for the individual. But anyway, there are lots of tips available, and I would encourage you to look at those and always try at least 3 different ones. Just one alone is not going to be enough. If you find your behaviours are causing problems for you, whether it's in your social life, work life, relationships, school, then it might be worth having an assessment with a treatment provider to determine if treatment or therapy could be helpful for you. There are different types of therapy available, all falling under the umbrella of cognitive behaviour therapy. The first is something called comprehensive behavioural treatment for BFRBs, otherwise known as COMB treatment. This is the practice we often use at Archways. It involves identifying a number of different domains that are associated with the pulling. These are a sensory domain, a cognitive domain, affective, motor and place. And so a very careful assessment is done to determine what is the individual's very specific, unique patterns of pulling, which will lead to then which strategies are going to be best used to target the behaviours. And again, usually just one strategy is not enough, and using at least 3 and 3 of the different domains is most effective. The type of therapy that was used before COMB came about was something called habit reversal training, and this is also still quite an effective therapy that involves a lot of monitoring, competing response training, that is doing something that's some kind of behaviour that's incompatible with picking or pulling, some relaxation training, and some maintenance work as well. Acceptance and commitment therapy has been researched a lot lately and has been shown some promise to be helpful for BFRBs. ACT, acceptance and commitment therapy, otherwise known as ACT, basically identifies individuals' values, and we have clients move towards these values despite the urges for picking or pulling. So we get people to react differently to the urges and thoughts about picking and pulling, and we use mindfulness to do this. So at Archways we use a bit of a combination of COMB and ACT as well. So depending on the individual, we can tailor the treatment. Finally, medication can be helpful as well, and we have a psychiatrist on staff who can assess the need for medication. It can be often helpful for anxiety, which can reduce some of the BFRB behaviour. But there's no really good medications directly for BFRBs right now, and we need a lot more research dollars in order to explore that. So in a nutshell, try all the tips you'll read about online, and if you can't find a good combination that works for you, consider reaching out and having an assessment done and to look at all your options for therapy. If you want to learn more or find a treatment provider, you can always visit the Canadian Association of BFRBs, or actually I think it's the Canadian BFRB Support Network, or there's a great American organisation called the TLC Foundation for BFRBs. A lot of acronyms to remember, but the main things, remember, look up BFRBs, research it, find out what's involved, find out where you can get help, and best of luck to you, and we hope we can help you in the future.